I'm Fred Cass. I'm a medical oncologist. I've been at the Cancer Center for almost 30 years. With 3 full-time genetic counselors, we're really one of the premier genetic counseling programs in the state of California.
One becomes a genetic counselor. We go through a master's program for genetic counseling, where we are trained both in medical genetics and then also in counseling.
For us here at the Cancer Center, we work directly with people who have either a personal or family history of cancer. Typically what a genetic counseling session might look like would be starting with taking a patient's personal medical history and then moving to look at the family history as well.
It's very important that we ask questions about both mom and dad's side of the family, as both sides are important.
Taking those two in combination often helps us assess what might be happening in the family and if hereditary cancer is a possibility.
Only about 5 to 10% of all cancer is going to be what we consider hereditary or caused by a specific change in a gene that's being passed down through the family. And so those gene changes, they can cause an increased chance to develop cancer. For the most part, it's not a 100% chance to develop cancer. And the reason that we want to identify families who maybe have a hereditary cancer condition is so that way we can reduce that chance to develop cancer and we can offer any preventative options.
For possibly hereditary colon cancer, we would talk about maybe increasing the amount of colon screening that someone gets, such as having colonoscopies more often. And that can be really helpful because a colonoscopy can actually prevent cancer.
So there are certain features that we look for when we take a patient's family history. So there's a few clues that can help give us an idea if hereditary cancer might be a possibility. So we look to see if there are 2 or more people that are closely related with the same types of cancers or cancers that come together. For example, 2 people with colon cancer or colon and endometrial cancer together. We also look to see if there's young ages of diagnosis. So often when cancer is diagnosed under the age of 50, that acts as a clue for hereditary cancer. We can also see a pattern of multiple generations affected, so a grandparent, a parent, a child, all with cancer. That can act as a clue for hereditary cancer. We can also look to see if there are any rare cancers, so something like prostate cancer in men, breast cancer in women, unfortunately are just very common. But when we see an ovarian cancer in a woman, that is more rare, and that makes us think about the possibility of hereditary cancer.
Also, polyps are important for looking at someone's increased chance to have a hereditary predisposition to colon cancer. If somebody has 10 or more polyps, then they should certainly discuss that with their physician and if there's a need to see a genetic counselor.
Lynch syndrome is the most common known cause of hereditary colon cancer. It's caused by a change in one of 5 different genes, causing those genes not to work properly, or one of those genes not to work properly. And Lynch syndrome causes people to be at a higher chance for colon cancer and other cancers as well. And so it can be helpful to learn about Lynch syndrome because it can help to inform screening for the patient and their family going forward. One of the big things that changes when someone has Lynch syndrome is the increased frequency of colonoscopies. So typically in the general population, someone might have a colonoscopy when they're 50, and then 10 years later if it came back normal. If someone has Lynch syndrome, they're having colonoscopies more frequently, about every 1 to 2 years, and starting at a younger age, just because we know of that higher chance for colon cancer. And doing colonoscopies is such an effective tool for both prevention and early detection.
In genetic counseling, we really think about prevention, and that's really our main goal. And so we want to see people, whatever stage of the life that they're in, so that way we can offer them kind of all the options that they might have available to them, or maybe be able to reassure them and say, oh, actually the cancers in your family are not very concerning for something hereditary or inherited.
The information that someone gains by being tested or meeting with a geneticist not only can benefit them, but can benefit their children, their grandchildren, their nieces, their nephews, their great-grandchildren.
Genetic counseling is very important to my family because of the cancer that we have in the family. There's so many of us that were unaware of the cancer gene and who needed to be tested and who could possibly have it. So finding out all that information and who needs to be aware of it was very important.
This is a real service to the community. We're looking to find families who may not realize that they have inherited a risk for the disease. We think that this is not only an issue of treating patients who have been diagnosed with cancer, but reaching out to our friends and neighbors to help them prevent the occurrence of cancer in their families. That's a hugely important part of our program.